Hello YouTube, I'm Dr. Fox. Today, I'm talking about cord blood banking. After the baby is born, some of her blood is left in the umbilical cord and placenta. This is called cord blood, and it is a very precious substance because it contains special cells called hematopoietic stem cells. Hematopoietic stem cells are special because they operate differently to other cells. Most cells work by making copies of themselves. For example, a skin cell makes another skin cell. But hematopoietic stem cells can change as they grow, so they become different. Then, why is this important? This is important because stem cells can be used to treat over 70 types of serious disease, which include genetic and neurologic disorders, as well as some cancers like leukemia and lymphoma. For some of these, stem cells are more likely to work than any other treatment, and for others, they are used if other types of treatment fail. They are also being used in a lot of experimental medical research to find new cures for diseases. Okay, you may wonder, is cord blood the only place we can get hematopoietic stem cells? My answer is no. They also exist in the blood and bone marrow of adults and children. However, it's better to use the ones in cord blood for several reasons. Firstly, stem cells in cord blood can help more people than stem cells taken from bone marrow, as they have more possible matches. We'll discuss this in a minute. And there's less chance the other person's immune system will reject them. Secondly, it's much more difficult to get bone marrow, and it can also be very painful for the donor, whereas collecting cord blood is easy and painless. Thirdly, bone marrow has to be used immediately after it is collected, but cord blood can be frozen and stored, so it can be used at any time. And lastly, if cord blood cells are donated to a person with cancer, they can strengthen that person's immune system, but bone marrow cells cannot do this. Another question is, are there any disadvantages to using cord blood to treat disease? The main disadvantage is that it doesn't contain a large number of stem cells. So, if, for example, an adult needs a transplant which has more stem cells than one donor's cord blood contains, then blood from several donors is combined. The next question is, will your baby ever need to use her own cord blood? Babies can have what is called an autologous transplant, which means that her own cord blood is transplanted back into her. However, this happens extremely rarely, as stem cells cannot treat either genetic disorders or leukemia or cancer of the blood in the same child that the cells came from, only in other people. Okay, next, how is cord blood collected? Cord blood is collected by hospital staff when you have your baby. After your baby is born, the umbilical cord is cut and clamped as usual, and then a doctor will use a needle to draw blood out of the cord and into a bag. It usually takes about 10 minutes, and it's completely painless. Occasionally, it's not possible to collect enough cord blood. For example, if the baby is premature or there's a delay before the umbilical cord is clamped. However, you can be sure that if there is any emergency, looking after you and your baby is always prioritized over the possibility of collecting cord blood. Okay, next, what happens to your baby's cord blood if you donate it? Your baby's cord blood will be stored in a private or public cord bank until an ill child needs an allogenic transplant, which is a transfer of your baby's cord blood into that other child. The sick child might be another member of your family, or she might be a complete stranger. But doctors have to check first that your baby's cord blood is a good match for the child receiving it. That means that her cells and the other child's cells have to have certain similarities. Otherwise, the other child's immune system may reject them. Okay, then, what is the difference between public and private cord blood banks? Public cord blood banks only store cord blood for allogenic transplants, that is, transplants for adult children. It doesn't cost you anything. In most cases, the stem cells stored there can be used by anyone who doctors think would benefit from them, but some public banks allow you to store cord blood specifically for certain family members who have diseases which might be treatable with stem cells. If you donate cord blood to a public bank, it will be screened to make sure it doesn't have any blood or immune system disorders or any other problems which could harm recipients. That means your blood will be tested, as well as the cord blood itself. The scientists at the storage bank type the blood in the computer database so it can be located quickly when it is needed for a transplant. In a private cord blood bank, sometimes called a family bank, cord blood is only stored for autologous use, just for your baby or for donation to a named member or members of your family. Before it can be stored, the blood has to be tested in exactly the same way as blood being stored in a public bank. Although you normally have to pay to store the blood in a private bank, in some cases, the bank may cancel the fee if you have a relative with a potentially treatable disorder. Okay, you may wonder, if you choose to donate your baby's blood, do you need to do anything during your pregnancy? My answer is yes. You need to decide which type of storage bank you want to use and get in contact. The bank needs to know you intend to donate the blood before your baby is due, so a collection kit can be ready when you give birth and bank staff can get a family medical history. You will also be asked to sign an informed consent form. If you have chosen a private bank, you will have to sign a contract and make a payment. Okay, next question. How do you get the cord blood to the blood bank? Staff from the blood bank will collect the blood from the hospital where you give birth. Okay, next. Is there anything else you should know before you decide whether or not to donate or store cord blood? There are a couple of practical points. Firstly, not every hospital collects cord blood, so find out what the policy is in the hospital where your baby will be born. And secondly, you need to make sure you can afford the cost at the private bank, not just an annual storage fee, but also the collection and processing charges. Bear in mind that if you donate your baby's cord blood to a public bank, then you and your baby may be helping other very sick children. The more blood there is in the public bank, the better the chance that other children will be able to find a good match. If you are from an ethnic minority background, this is particularly relevant to you because ethnic minorities are less well represented in public banks, so it is more difficult for members to these groups to find a match. Lastly, if you already have a child who has an illness that could be treated with stem cells, it's definitely a good idea to store the cord blood from a biological sibling, as that could be a good match. However, doctors don't recommend you keep cord blood for a new baby who doesn't show any signs of that sort of illness, just as a sort of insurance policy. Okay, thank you for watching. See you soon.